Hi friends, in this series of fluid therapy, today I will talk about isotonic saline, that is 0.9% sodium chloride. First is the disclaimer. Caring Doc YouTube channel does not provide medical advice, and information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only, and information provided here is not to be used as an alternative to healthcare professionals, diagnosis or treatment of any person or animal. Please seek the help of a medical expert for the diagnosis, prevention, and treatment of the medical illnesses. There is no endorsement for any brand or company. Dear friends, isotonic saline, that is 0.9% sodium chloride, that is normal saline. Its composition is 1 liter of the fluid contains 154 milliequivalent of sodium and 154 milliequivalent of chloride. So each 100 ml of fluid contains sodium chloride as 0.9 grams. Sodium chloride, as we know, is chiefly in extracellular fluid, and it helps in maintaining the osmolality of the extracellular fluid. So isotonic saline is used to provide major extracellular electrolytes. During vomiting and diarrhea, along with the water loss, there is also a substantial loss of sodium chloride. 0.9% isotonic saline is very useful to correct both fluid and electrolyte deficit. Isotonic saline, it is distributed chiefly in the extracellular fluid, and it will increase the intravascular volume substantially. Therefore, isotonic saline is very useful IV fluid to raise the blood pressure in patients with hypovolemic shock. The indications for normal salines are water and salt depletion as seen in diarrhea, vomiting, excessive diuresis or excessive perspiration, that is sweating. Treatment of the hypovolemic shock, treatment of alkalosis, for example in alkalosis if there is vomiting with dehydration. In severe salt depletion states or hyponatremia when rapid correction of sodium is necessary. There are certain miscellaneous conditions where the sodium chloride can be used as initial therapy in diabetes ketoacidosis, treatment of the hypercalcemia, fluid challenge in prerenal ARF, irrigation for washing of body fluids. It also acts as a vehicle for certain drugs and can be given safely with blood. Hypertonic saline, that is 3% sodium chloride, it is used in the treatment of the hyponatremia due to SIADH or water intoxication along with the furosemide, as it provides greater sodium in lesser fluid volume. That is, sodium concentration here in 3% sodium chloride is 513 milliequivalent per liter, but in 0.9% sodium chloride it is 154 milliequivalent per liter. Various contraindications for the use of 0.9% sodium chloride are: we have to be cautious when we use it in hypertensive or pre-eclamptic patients. So we should avoid it in very hypertensive or pre-eclamptic patients and in patients with edema due to congestive heart failure, renal diseases and cirrhosis. We have to administer the 0.9% sodium chloride carefully in a young and very elderly patients. Dehydration with severe hypokalemia is also another contraindication, because in severe hypokalemia there is a deficit of even intracellular fluid potassium. So the infusion of the isotonic saline, that is 0.9% sodium chloride, without additional potassium supplementation will aggravate electrolyte imbalance of the intracellular fluid. Hippocrates has said, wherever the art of medicine is loved, there is also a love for humanity. With this, I conclude today's topic. Thank you very much.